Hi there, this is Varsha from Tiju's Academy. So here we are going to discuss the different scenarios of a just examined case. As the name indicates, it gives an indication that we have already examined the patient. So we are going to discuss how do we give an introduction in such sort of a scenario. So we have to justify the other title also, that is without introduction. It gives an idea that we don't need to introduce ourselves in this particular scenario. So let's have a discussion on the different scenarios in which the just examined case falls. So the first scenario, when you have examined the patient and now you're going to have the conversation with them. So we got an indication here that we have already met the patient before and we have carried out the examination. So in such sort of a situation, we'll be asking the patient's name during the preparation time, and when you start the conversation, as we have already discussed, we don't need to give an introduction here, we'll be just acknowledging them for allowing us to do the examination on them. So we'll be doing it this manner. How may I address you during the time of conversation? Well, thank you for allowing me to do the examination on you, Thomas. So this is it. I hope you people got an idea. Now let's have a discussion on the second scenario, wherein you have examined the patient and you'll be having a conversation with the bystander. So here also you got an indication that you have already met the patient before and have carried out the examination. For example, you have just examined a 6-year-old child and you're now going to have a conversation with the parent. In such sort of a situation, you can inquire the patient's name during 3 minutes preparation time, and when you start the conversation, you can just say, "Thank you for allowing me to do the examination on John. Could you please state your name for the better communication?" This is it. I hope you people got an idea regarding the situation. Now let's look into the next scenario. The third scenario. In such sort of a situation, you have already examined the patient, you're going to have a conversation with the bystander, and the patient is not present for the conversation. So in such sort of a situation also, we got an idea that we have carried out the examination of the patient and we're going to have a conversation with the bystander. So how do we start such sort of a situation? So here also we'll be inquiring the patient's name during the 3 minutes preparation time, and when we start with the conversation, we can just say, "Well, I have completed the examination on John. Could you please remind your name once again?" This is it. So this is only required in this sort of a situation. I hope you got it. Now let's look into the last scenario, that is a merged case. So wherein you can have a combination of two different type of cases. For example, a home visit and a just examined case. The most important thing that I want you to focus here is, you have already met the patient before and you have examined them also. If in case you're having a conversation with the patient, you can inquire the patient's name during the 3 minutes preparation time. Then you can just acknowledge them by saying, "Thank you for allowing me to do the examination on you, Thomas." If in case you're having a conversation with the bystander and the patient is not present there, you can just say, "Well, I have completed the examination on John. Could you please state your name for our better communication?" The most important thing here is, you don't need to focus about the introduction of the home visit. We have to look into the fact that we have met the patient before and have carried out the examination. So we'll be going with the introduction of a just examined case. I hope you people got an idea regarding the different scenarios of a just examined case. So please make a note of these things when you are encountering such sort of a situation. So for more informative videos, follow Tiju's Academy. Orappanu Vijayam.